नमस्कार। उदय इंडिया डिजिटल में आप सबका बहुत बहुत स्वागत है। आज वर्ल्ड कैंसर डे है एंड कैंसर हैज बिकम really a threatening disease for the human society or humanity in the world and in India. And to discuss about the concerns of rapid growth of cancer in India, we have with us Dr. Professor G.K. Rath, who once upon a time heads All India Institute of Medical Sciences. Also, it was his brainchild to grow a huge cancer institute at Hisar. Dr. G.K. Rath, I welcome you to the digital media of Uday India. And it is our really privilege that Dr. G.K. Rath is with us today with Uday India. Dr. Rath, I welcome you to Uday India digital channel, and we are
Thank you.
really privileged to speak to you today because today is World Cancer Day. And Professor Rath, as you know, India is having more than 15 lakh cancer patients, and India is third in the world for cancer patients. And the rate is growing day by day. Can you, in brief, tell our viewers what may be the reasons that cancer patients are growing so fast in India? Please.
I'll tell you first why the cancer patients are growing. Then I'll tell
Yeah,
you some positive things how to approach cancer. Cancer is
correct.
growing because of mainly two reasons. One is the tobacco habit. In
Okay.
India, we take tobacco by chewing, by
Yeah,
smoking, by gutka, and by all these means.
yeah,
Number two cause of cancer in India is the cervical cancer and because of the HPV virus. And both of them
yeah,
are preventable. That's a good thing about cancer. If you don't take tobacco, cancer will not happen. Cause is in Punjab. In Punjab, it's a good state of India where they
yeah.
don't neither smoke nor chew pan, nor take tobacco. In my 50 years at AIIMS, I have not seen a single person who is developing cancer of the oral cavity in Punjab. Second,
Yeah.
cervical cancer is due to a vaccine, due to a virus called HPV virus, and that can be prevented by HPV vaccination, which is freely
Okay.
available now.
Yeah. Dr. Rath, Government of India, especially Prime Minister Narendra Modi, has given special focus to cancer to eradicate cancer, and this budget also government has special plans. As a senior doctor in this field, you have worked more than 50 years. What your fraternity or the medical science in India expects from the government, whether the infrastructure, facility, medicines are to your expectation to meet out the concerns of the cancer patients in India?
Thank you very much for asking this important question. As you
Yeah,
told just now, the government in this recent budget has
yeah,
clearly stated that 200 daycare centers will be established for cancer. That's a huge development. The other things
okay,
where government is doing, where all specialist doctors are helping, are to reduce the price of radiotherapy, chemotherapy, and surgery. In radiotherapy, government is helping the manufacture of a radiotherapy machine like linear accelerators, cobalt, and simulator. We are now manufacturing indigenous robots at a cost
oh,
of 5 crores instead of 25 crores being imported. Our country is also manufacturing now cheaper chemotherapy machines. So
okay,
we all specialists, and with the help of government, we are progressing very fast in the field of cancer.
okay. But Dr. Saab, as you know, India is having huge population
Yes.
and primary healthcare, secondary healthcare, tertiary healthcare. Because of awareness, normal common man, poor man in India cannot get facilities, even if they cannot, they even don't know when they are afflicted with cancer. So most of the majority hospitals in state governments, district level or block level, there are no facilities for the people to understand what is this disease. So how this problem can be sorted out?
Let me tell you, I am in AIIMS and in Delhi for more than 50 years now. The government
Correct.
has introduced this Ayushman Bharat PMJ scheme.
Mm-hmm.
In government hospital, as you know, the treatment is anyway free. But this
Yeah.
facility is available in all private centers in the NCR, because I can tell you about NCR, because there are more than 35 centers where if you have a PMJ Ayushman Bharat card, it is totally free. I have seen no person who has gone without any treatment. So if you have a Ayushman Bharat card in government hospitals, anyway it's free. And in private hospital, by this Ayushman Bharat card, you can get free treatment.
But Dr. Rath, you are also from Odisha,
Yes.
and you have seen there is a huge patients now in Odisha. Even if they are having Ayushman card, they are not getting facilities, proper treatments in government hospitals, and there are few private hospitals which the poor people cannot afford to. So how this problem can be solved?
Yeah, in fact, the main problem just 20 years back that the cancer centers were very, very minimal. There were only three in our state of Orissa, Cuttack, Burla, and Bhubaneswar. Today, you'll be happy that in the twin city of Cuttack and Bhubaneswar, there are 15 centers, and
Okay.
most of them either can avail a state government scheme like Biju Arakya Yojana or Ayushman Bharat. So if somebody wants to help a patient and if patient is interested, I have seen that majority patients are availing treatment, and the patients coming from Delhi from Odisha has significantly reduced. They don't come now. Same facilities are available.
Okay, but Dr. B, suppose a patient is in a third stage or fourth stage or fifth stage, whether the Ayushman, if they are a member of Ayushman Bharat, whether they can get all the medicines free, surgery free,
I
everything is free.
Thank you. I'll tell you an interesting thing. I don't know whether you know or not. There are now almost 8 states. Odisha is one of the proud states where we have 30 districts in Odisha. You will be very happy to know that whenever you go to Odisha next time, you can find out that every district in Odisha, all the chemotherapies are given free of cost with the advice from Acharya Harihar Regional Cancer Center. The drug is
Correct.
procured by the government of India, and they are
Hmm.
distributed to all the 30 districts. This has happened since last 8 years or so. Very, very important development.
Hmm. Okay, but Dr. Rath, how patients come from states to national capital for this sort of statement, and how this number can be reduced?
Yes, as I told you, with the opening up many centers in Orissa itself and opening up a AIMS in Bhubaneswar, the see people also go abroad. The people who have money had can go abroad to Delhi, Bombay, Calcutta, Madras. They will go. Very earlier, most people were going. But let me tell you, I am here since 50 years. Previously, say I came in 74. 74, the number of people who are coming now it is significantly less.
Mhm. But Doctor, I am again asking these questions for the interest of the society.
Sure.
If one patient, any patient, in fact, in India, if he is a member coming under Ayushman Bharat scheme, he can get all the medicines required for cancer free. Number
Free.
one,
Yes. Yes.
he will get a free surgery and chemotherapy free for this
Radiotherapy
treatment, for
also. Yes.
physiotherapy also. It is all free.
Radiotherapy. Yeah, all radiotherapy, chemotherapy, surgery are all free. And let me tell you, we actually patients may not know. We as doctors and you as senior media professionals can guide the patient that look, this Ayushman Bharat is not only available in private center, with government center, but also in private centers. So they must go.
Okay.
Everybody don't have to come to big centers in big cities. They can get in private
Mhm.
center. And in Odisha particularly, what the government has done, that suppose somebody is advised 6 courses of chemotherapy, a breast cancer,
Okay.
6 courses of chemotherapy. He doesn't have to come to Acharya Hari Cancer Center, every second week or every month. He can take in
Mm.
Koraput or Malkanagiri in his
Yeah.
own district, free of
Okay.
cost. It is being given free by the government. It's a very good scheme.
That is a great thing. Yeah. Yeah. Doctor, you are a senior doctor. The whole nation knows you. Recently, there was a news that Russia has invented a vaccine for cancer.
Yes, yes.
How do you react to that? Can you
Well,
explain
this,
that whether
yeah,
it is?
I also know that news, but this has yet to be proved finally. See, there are
Okay.
many things which are in the stage of research. If this comes out, this will be really breakthrough, and that person will get a Nobel Prize. But this has to be proved beyond doubt in majority of cancers. We are about to test those test here.
Okay. Doctor, during COVID period, India
Yes,
was the only nation in the world who was successful in finding the first vaccine.
yes.
Equally, cancer, as India is in the third position in the world, where India stands in the research and development in finding the cancer vaccine. What is the
You,
ground report?
I'll tell you. The cancer vaccine is very effective in preventing cervical cancer. It's called HPV vaccine. Previously, we are importing everything. Now you will be happy that the same company has produced a vaccine called Cervabac in the country, and there is a national task group for vaccination, and that national task group, spoke to the chairman also, and they have
Mhm.
already recommended to the government to include this vaccine in the national immunization program. Like we have
Mhm.
national immunization program, we have DPT polio. This is going to be included. People are going to get it free. Our
Mhm.
country has already developed it. Just like you told, we were one of the few countries which developed our own vaccine. The same company
Yeah,
has already developed a vaccine against cervical cancer also.
it is manufactured in India
Yeah, India.
for both breast
Manufact-
cancer and cervical cancer.
No, no, no. Breast cancer actually cannot be prevented. Breast cancer, unfortunately, cannot be prevented. Only 10% is genetic. So, what we advise, and the government also advises, for breast cancer
Mhm.
and oral cancer, we have to examine the mouth and breast and then detect. But for cervical cancer, it can be prevented. Breast cancer, unfortunately, there is no technique to prevent till now. You have to examine your own breast and get a mammogram done after the age of 45.
Okay, and let us come to the few things which is really correct, and maybe they are the factors for becoming a cancer patient. Like Dr. All these fruits, vegetable, or whatever food items we are getting in the market, they are all infected with lots of fertilizers, chemical fertilizers, and all the fruits, apple, vegetable, everything. So we all are prone to that. So as a awareness or as a preventive, how do you suggest to the common man to stay away from this dreaded disease?
Let me tell you that India is in an advantageous state over the Western countries because we are mostly vegetarian. They
Yeah,
mostly take meat for which their cancer rate is very high. India's
yeah.
cancer rate is almost one third to one fourth of United States.
Hmm.
And these fruits and vegetables getting contaminated with these chemicals is a problem,
Yeah,
but there is no proof rate. What is proven is definitely the tobacco, the virus, which is
yeah,
HPV virus, and the pollution.
yeah.
Pollution. We are trying to prove that which chemical toxin can be. They're definitely harmful, but in scientific world today we have to see that proof is required to take care of something. But definitely we should take vegetables after cleaning it thoroughly.
Okay. Doctor, can you just, in 2 minutes tell a common man, like starting from early years till 60 years of age, what are the precautions one must take to prevent cancer?
Excellent. There are 7 warning signs of cancer. As you know that CAUTION. They are all available in Google. Like change in the size of the water mole, any sore that doesn't heal, unusual bleeding, cough, they're all available. The main thing to tell to our public is that कोई भी जगह अगर कोई भी घाव है जो नहीं सूख रहा है बियॉन्ड 2 weeks, नंबर टू, किसी को बहुत ज्यादा खांसी हो रहा है और मोर देन 2 weeks हील नहीं हो रहा है, किसी को बहुत ब्लीडिंग हो रहा है, the
Mhm.
ladies can have bleeding once in a month during their periods, otherwise कहीं से किसी का कोई ब्लीडिंग नहीं होना चाहिए. अगर कोई ब्लीडिंग हुआ, गांठ हुआ, अल्सर हुआ, डॉक्टर को जरूर दिखाना चाहिए. बट अनफॉर्चुनेटली ये सब हम ज्यादा शायद बोल नहीं पा रहे पब्लिक को. जो पेशेंट आते हैं वो बोलते हैं मेरे तो मुंह में ब्लीडिंग हो रहा है 3 महीने से, नाक से ब्लीडिंग हो रहा है 5 महीने से, रेक्टम से ब्लीडिंग हो रहा है. तो ये सब कोई भी ब्लीडिंग, कोई भी गांठ, कोई भी अनयूजुअल चीज या कोई भी गांठ, इतना बड़ा लोग कोकोनट जैसे गांठ लेके आते हैं, ये सब हमें
Mhm.
और आप जैसे मीडिया पर्सनल को, पब्लिक को बताना चाहिए.
Correct. And what according to because you were in the system, management system to eradicate cancer, and
Yes.
our Prime Minister has got a great hope on you. We have seen. And Dr. What should be the awareness? How the government or the role of media or government or doctors should be? Because this is really a huge problem for the mankind.
Let me tell you,
Yeah,
all of us, government, media, and we, the professional, have done a lot. And let me tell you what we have achieved, and it is our proof.
yeah,
We have a program called National Cancer Registry Program. We also
yeah.
have a program called National Cancer Control Program. You will be happy to know that when I joined AIIMS in 1974, the incidence of cervical cancer was 51 per 1 lakh. Today,
Okay.
in big cities, it's 10 per 1 lakh. Tobacco related cancers number is coming down in many registries. We have many registries. And the incidence of cervical cancer is also coming down, but we have a huge state, huge country. So we need to bring down further. It is happening. All our efforts are taking place. But as you know, we are a huge country and a lot of efforts are required.
Okay, so Daksha, thank you. Really, you have given lots of, you have told our viewers about the awareness, about the precautions, about the food habits, and what India is doing for invention of, medicines, and how the government of India has given facilities through Ayushman Bharat. That is a
Yes.
good piece of news for all the viewers. They must know that they'll be getting free medicines and free chemotherapy at the district level even, and
Yes.
even it
Yes.
is available in private hospitals also.
Yes. Right.
So that is a great thing, Rishabh. We are really thankful that you have joined with us, and I will tell our viewers that you are a really great person to eradicate cancer, and you have joined in 70s in All India Institute of Research
74
and
I joined. 1st of July
74.
1974 I joined.
Yes,
50 years.
so
Thank you so
yes,
much.
50.
Thank you so much. And we must
Thank,
telecast this to the public frequently. Thank you.
yeah, yeah.
Namaskar.
Thank you, Rishabh.
Namaskar.
Thank you. Namaskar.
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 Namaskar.